Okay, we're here on our Clinical Symposium and we are very excited to be welcoming Diego Gomez to talk to us today. And so before we sort of get into the topic and everything, Diego, we're really thrilled to have you here. Please, can you just tell us a little bit about yourself and your background?
Okay. First of all, hello to Gila and Jamie, and thank you for having me here. It's a real pleasure. And well, as you say, my name is Diego. I live and work in Spain, but I live in the past. I spent 10 years in the UK, where well, I went at the beginning to study English, and then I went to study osteopathy. I became interested in osteopathy. And then I went to the British School of Osteopathy, what is now the UCO, University College of Osteopaths. And then I did really find my life there, working, studying osteopathy. I studied with Jamie. We were, in the final 2 years, we were together over there. And then I enjoyed so much those 4 years of studying. It was hard and it was amazing. We had a group of students, Manus Senestra, where I came with what we call classical osteopathy. And when I was in my fourth year, in the final year, I went to Maidstone to study this postgraduate course in classical osteopathy. And then once we finished, I was lucky. I went to work to Maidstone, and I met Jamie over there, and we work along with John Wernham. And yeah, that changed my whole view on osteopathy, and I think it gave me a whole sense to my profession, basically. And ever since, I've been involved with what we call the Institute of Classical Osteopathy. After 1 year working in the UK, I came back to Spain and I got married here with my wife. And then I opened my clinic, and we ran this clinic here in Pamplona. And I started on my own, and now we have 4 or 5 osteopaths now. We are super busy. And we mainly work with what we call classical osteopathy or body adjustment. And yeah, people seems to like it, and we see good progress with patients, and it's fantastic. And then in Spain, I got involved as well in teaching in Barcelona. I was teaching in undergraduate, and then I do the postgraduate diploma in classical osteopathy as well. So more or less during all my career in osteopathy, I have been in contact with many great osteopaths or good osteopaths, and I had, I started with John Wernham, but ever since I had the interest listening many other osteopaths. I also did some translation from English to Spanish, so you tend to see, the way different osteopaths think about, what they do and so on. So it's a nice mixture of things, yeah.
Talking about sort of the importance of osteopathy for babies and children so that they can grow into healthy adults. What is different about your approach when you're treating babies and children compared to adults?
Well, it changes a lot, basically. You have a small patient, they don't communicate, they just cry and smile, and they look at you, and it's amazing. I always say my biggest challenge in osteopathy has been to treat babies, basically. I took a diploma, 1 year diploma, but I think the biggest change happened when I had my own kids as well, being able to hold babies and being comfortable with having babies around. And I think it's really complicated. Treating babies is not, I don't find it's super complicated. I'm talking babies from 15 days, which I normally see, to 6 months or something like that. They are lovely patients. But the main thing is having, it's not about treating the baby in only the baby, is having the mother and having, if possible, the father as well in the you know, in the consultation in the clinic, and is making sense of how is the family, you know, how they are bonding with this baby, and how is the mom. If we have a happy, comfortable mom, we possibly will have a happy, comfortable baby. And when I take a case history, well, patients first, they say, well, a case history, but what history of my baby? No, it's just a newborn baby. But there are so many different things that we have to understand since how was the pregnancy, how was the delivery, if they are breastfeeding, bottle feeding, how they are sleeping, and so on. And then once we chat about, you know, the baby and we feel comfortable, then I go into the treatment. And one of the things I changed a few years ago was at the beginning, I used to take the baby in hands or having the baby on the treatment table. But now when they're small, I put a pillow in the lap of the mom or even the father if he's around as well. And I treat the baby on the pillow in next to the mom. And sometimes if they are crying or they're uncomfortable, I put them on the breast if they are breastfeeding. And those things have changed a lot, especially with young babies, you know. And you know, I don't know, it's having a feeling of how the baby is not going into something specific. At the beginning, is having a feeling of the body.
Yeah.
It's more indirect approach, I would say. It's not so much into hands-on doing something. It's more, you know, feeling comfortable. Yeah.
So what would prompt a parent, a mother, father, a family, to bring a baby to see you? What is it that they're bringing the baby for? What's the problem with the baby? Because obviously when we see, say, adults, they come in and say, my back hurts, my neck hurts. So why would a parent or set of parents bring a baby in to see you? What are the problems that they have?
Yeah, well, normally it's colics, you know, what they call colic pain, and nowadays they are changing, and in the nurse and you know, even the pediatrician tell the patient, no, it's better if you have a check with the osteopath, even if the baby is fine. But I would say all babies have to be checked by the osteopath, I would say. And then it's normally colic pain, but colic pain is a big name for many different symptoms of the baby. And it's not like the stomach is hurting, you know, like adults, you know, when we have a colic, it's it's my digestive system. Yeah, it is, but where is the issue coming from? And it can come from many different places. So that's the main thing. And then when we talk, that's why it's important, the case history, because I understand all the stages of the baby up until now when they were born and the delivery process and, you know, how are they getting on? And those, you know, whatever comes in the case history makes you aware of those points that they might be in trouble, I would say. So it's not only the head and neck that we normally osteopaths go to the head. It can be many different areas. Yeah.
So would you say then that so the colic, which is, what do you think is actually, because obviously with an adult, when we look at adults, we might say, oh, there's a facet joint a bit stiff, or you know, all these tissues are hard. Because obviously a baby hasn't walked, it hasn't moved. So what is it when you examine your baby that you are finding? What is it that you're feeling on a baby's neck or on their back?
Well, it feels, you know, the softness of the tissues. You know, a baby is very soft, very malleable. And when you get to the key area where they have a trouble, they will cry or they will twist around or they won't feel comfortable. So you have to be aware of those little movements that the baby is doing or crying and then that's where the problem normally is. But saying that is as I say, it's not treating one problem, it's treating the baby. and you cannot spend, in my view, because pediatric osteopathy is very large, and I understand there are people that are super, prepared on this osteopathic field.
Mm.
But what I do in the clinic is I don't spend the whole treatment in the neck, or you treat to move and go away from the issue area. Sometimes when they are very crying, or they're very uncomfortable, just having a feeling in the cranium, just really light feeling, and going through the involuntary movement while they are feeding, that brings calm. I do a lot of work through the mouth. When they are sucking, I put a gloves in, and I work with the tongue, with the soft palate, and it gives me a moment to see the tension in the cranium, in the base of the neck. And you use different tricks so the baby is not super uncomfortable all the time.
It's interesting, isn't it? Because I think sometimes as osteopaths, well, as all sort of, manual therapists, we sort of get accused of being overly biased to the spine, but working, like you say, in the mouth, in the cranium, and around the neck is so important. So when you are working, let's say, on the spine of an infant, what is it that you're actually doing there? What is it that you're trying to achieve? Is it similar techniques? Is it a similar thing that you're doing? Or?
Yeah, I normally, it's we do more a direct approach to the spine. I normally go to the hips, and I like to open up the hips with the pelvis, even in very early young babies. And I like to feel first of all, the hips, make sure that there is not a lot of tension there, because there might be some pulling into the sigmoid, the colon area, and they might have some, constipation or something like that. So trying to open up, which is important as well for babies, because the pelvis also suffers a lot. And if the baby was was sitting, then it is more important, because all the pressure was in the pelvic area. And then I go up into the spine and then check. But normally what I do is I put the baby in my laps, facing down, and then we open the legs and we close. And then as you open the legs, you allow the spine to move in this direction. We know when they are born, there is one main curve in the spine, but they have vertebra like everybody else. And it's just feeling what areas might be in trouble. So when they have, like, for example, a ventouse or forceps delivery, a lot of the traction, I don't know if people have seen, but a lot of the traction goes direct into the whole spine. And normally the upper section of the spine might be in trouble. And I try to, when the baby is on my laps facing down, I get a hold of the head, the whole head, and then I use that as a lever to go to the dorsal area and try to sense what is happening there. But as I say, everything is really, really gentle. You don't push or pull as I will be doing in adults. And yeah, it's one concept that normally when colics or even with plagiocephaly, when the baby's head is flat on one area, people focus on the head, which is fine, but you have to focus on the forces that are coming from underneath as well. Even if the baby is not able to see it and they don't have the gravity forces so strong, it is important to make sense of what is happening in the spine. That's why when I said at the beginning, you treat the baby.
Yeah.
It's everything is there. I don't know.
Yeah. So, yeah, I mean, it's interesting, isn't it? Because I think that comes back to, again, sort of osteopathic principles, as opposed to, like you just said, finding a bit and working on that. And I mean, I've had probably in the last year, I don't treat a lot of babies anymore, I don't know why, maybe people don't trust me.
I don't know. You treated our children.
Yeah, I
well,
treated
babies, and
our
you've had-
children. I suppose you attract it, but I know a lady bought me, like you just said, and the thing she said was, my baby's head is all misshapen, and of course, it was flat on one side and all a bit misshapen, and I just wanted to know what I could do. But what you've, and obviously in the medical field, they might, and you do see babies with helmets and things on.
Helmets.
But I think what you're saying is that we mustn't look at just the parts. We've got to look at the whole,
The whole.
the whole. So what you're saying is working up through the spine towards the head to take away any
Yeah.
obstructions, or is that what you have I got that right?
Yeah, exactly. Yeah, totally. As I was saying, when you have these large babies that they were in uterus and they were in one position, it's not only the head is positioned in that way, is that the whole spine is in that position. It's funny when you get a newborn baby, it is very easy to put the baby in the position they were in uterus because they like it. You know, you take the head, the legs, you twist them a little bit. You it's a whole torsion, and then suddenly you feel them relaxed. But it's like a ball. It's like they're in that shape. So that's what I mean. Is the whole spine is involved, and the sacrum and the pelvis is not. The head is normally the end result of what is happening underneath.
So in terms of, let's say, when they do get to puberty, you know, and they get a bit older, what sort of issues are they getting? Are they starting to get backache? Are they starting to get growing pains? And how can you
Yeah, that's in the last couple of years, I've been having more these teenagers, I would say. I don't know if there is more awareness from the parents to bring their kids along, but it's super good because what I find is that they are growing so fast and they are changing so fast. At the same time, they have to be at the school. The studies become more difficult. They have to pay attention in the school. The reading with the eyes, I mean, and then they start doing sports, and nowadays sports can be really hard. They spend many hours, football or tennis or any sport, then many days a week. For me, that's another issue. That's something I will keep. But what I mean is there are many challenges in those little bodies that they still have a growing spurt in the next 6 years. As I was saying, I think girls, because of the period, the pelvis, in my experience, changes from being a kind of a kid pelvis to like a woman. It gets expanded and it gets in a different shape of movement. And then I like to integrate this pelvis within the growing of this girl. And I think it is important for the development, that period and development of those organs and so on, which I think is really nice. And again, it's different to boys. Boys are stronger. They develop later in life, but they develop like more rigid, more stronger bodies. But at the same time, they need a treatment as well, because you want to have a body which is free of tensions, because all the sports and the hours they spend at the school sitting and, but they are growing. And sometimes parents, they put the brace on the mouth, they put insoles if they are having some issues, many inputs from outside are having an impact on these little boys and girls, and you have to be dealing with all that, making sure that they are loose and they are not under the stress of those tissues.
Yeah.
And on top of that, I would say, sorry, but also in the last few years, in the last 3-4 years, I've been having kids with tensions that they look more like adulthood, because all the stress, as I was saying, you go into the neck and head and they come with headaches, and they are 14 or even younger. And you think, why, all that tension in such a young body? And well, you have to deal with that and see if there is some other issues. I don't know. You always talk to the parents and see if the kid is fine at the school, or but I don't know. Sometimes you find really, really difficult cases there.
Do you think that is like, obviously, because that's sort of what we experience over here. So it's, you're in Spain, we're in the UK. So do you think that is because children are, I don't know, more sedentary, they're looking at screens more, their nutrition is different? Why do you think that young teenagers, you know, are becoming, feeling like adult bodies, you know, rigid and stiff and problems?
Yeah. I don't know. I suppose it's a big question why it's happening that. It would be too easy to say it's because of the mobile phone, which might have an impact, obviously. But I think, as I was saying, for example, with the sports, I don't find normal to have a 12 years old boy or girl training so hard and almost becoming professional athletes when they are so young. And there is not so much playing normal playing. Just enjoy the sports that you're doing. It's all competition in the sports, competition in the classroom because I want to be the first, having the best grades. I don't know. It's too much, and the poor boys and girls. You can feel the stress in the body. And
fantastic. Well,
Thank you,
I mean, there's a wealth of stuff there for everyone to sort of learn from. I've learned stuff already. I mean, I've not, like I said, I've not treated a baby for probably maybe a year. So sometimes if you're not doing it all the time, you forget. So it's amazing. Thank you for sharing that. And well, we could do a part 2 and a part 3 and whatever at some point. But
not that many. I don't know.
Yes. Thank you for joining us, Diego.
Thank you.